So thank you, Michael, and Harvey, if you're still here. Really, we're here in large part because of the seminal thinking that much of which took place in this room and other rooms, other halls of the IOM. This notion, this premise that healthcare delivery, health services, and clinical research could all be much more closely brought together in a single enterprise, as Harvey said. So I have a couple things I want to say before making a few opening comments and turning it over to Eric. And the first is add my thanks to Eric, to the entire planning committee, and let me be the first of many to thank Claudia Grossman for her leadership in putting this meeting together. Whenever you learn that Claudia is going to be organizing your meeting, you say, this is going to be fun, and it always is. And I have one very serious piece of housekeeping business, and that is that when I sat down at my seat this morning, I found a cell phone that wasn't mine. And having lost innumerable cell phones personally, I know what it feels like. I have a hint this might be a person on the staff, but I just want you to know that I've got a cell phone that doesn't belong to me. So we're going to be talking, or we're stimulated and caused to be here today by the creation of PCORnet, which is a $100+ million investment of PCORI that is really based entirely on the premise that indeed it does make sense to engage healthcare systems, their clinicians, and their patients, particularly their patients, in a process of putting data together, standardizing it, and using it, yes, for quality improvement, but using it for clinical research, using it for health services research as well. There have been some barriers to this over time, and not everybody has bought into the notion that these belong together. On the other hand, there are a number of stellar examples where rigorous research has been conducted in healthcare systems, supported by and participated in by healthcare delivery systems, and we have a number of those folks in the room today. But we also, as Michael said, we have a lot of people that have met each other before in this room, but if you're a person who hasn't met many other people in this room before, then that's what we celebrate here today, the notion that we are expanding, and we're bringing this group together to think about how we expand the idea and the practice of putting research and clinical care more closely together, more continuously together, more organically together, to make it a more efficient system, to make it a higher quality system, to make it a system that actually makes more sense to those who participate, be they patients or clinicians or system leaders. We have seen a number of previous efforts, and I hasten to say that PCORnet stands on the shoulders of a number of efforts to harness data across multiple healthcare systems. Usually these have not been electronic health record data, so one of the novelties is that through the efforts of the ONC and many others, medical records are now a central part of medical care and creating a body of data that have not really been anywhere near adequately tapped yet. Most of these previous efforts, though, really were the product of partnerships between researchers, between funders of research, those who saw the potential, the populations and the data, researchers who saw opportunities to pursue the questions that were of interest to them and had opportunities to link to systems. But we don't have a lot of examples, and again, some of the exceptions to what I'm going to say are here in the room today, but we don't have a lot of examples yet where health systems have been in the lead. And in fact, we have often heard, and not without reason, that research simply takes too long, that research often misses the point just by that much. So it's often of interest, but it's not always helpful. It's not easily applied. So our premise is, and in addition, that research can be a threat to patient privacy, and it can be a threat to organizational interests, competitive proprietary interests. So we're here today to explore some of those barriers, some of those problems that have gotten in the way, and some of the solutions that have enabled certain systems to move ahead in this area. So now if we could put up this slide, I just want to say a couple words about PCORnet. Pardon? There we go. Good. So a number of people in this room are the researchers from 11 clinical data research networks or health systems. And along with the researchers are typically representatives from the leadership of these systems, from the informatics, from the C-suite. And so this is a dialogue that necessarily involves not just the researchers and PCORI and the IOM, but you, each of you in your position as a leader within your system. And when we say systems, we're in PCORNet, we are not talking necessarily of a single integrated delivery system. One of these systems is the state of Louisiana with the system centered around the health insurance exchange. Two of these systems are cities, the city of Chicago and the city of New York, and they're the backbone of the systems are the CTSAs in the academic medical centers in those cities. One of the systems is a network of federally qualified health centers. One of these systems is a network of children's hospitals. One of these systems is Kaiser Permanente, partnered with Group Health, Denver Health, and Health Partners from Minneapolis. And about 5 to 6 of these systems are academically based CDRNs, usually partnerships of 2, 3, even 5 or 6 academic medical systems, state medical school, academic medical center delivery systems. So we have all manner of systems. Each of them is challenged to bring the data to create complete data, bring it together for the purposes of research, but also to bring the system leadership into that. We're going to work today on some critical questions. One of those is, and let's see if you can just advance that 3 times. Yes. So one of the questions we certainly want to talk today about is the interaction of health systems and their leadership with the research teams who are partnered with PCORI to do this work. And I know that most of you are already closely integrated, but we want to continue advancing that, not only to improve the relationships in your settings, but to talk to others about how this can work. Hit that, and also, the question of governance is a critical question that PCORNet will have to wrestle with, and you will play a role in that. Governance refers to the rules by which, as a part of PCORNet, we agree on when we will and when we won't share data. And I don't necessarily mean transport data electronically across the country, but I mean join in a piece of research where our data is pooled with other research. Under what circumstances, who decides, how do we protect organizational and individual privacy and security? A critical area is that of ethics and regulatory oversight. If we're really going to embed research seamlessly into healthcare delivery, then we have to do something about matching the level of oversight, matching the need for informed consent, matching the intensity of that effort with the level of risk and the importance of the question to the patients who would participate. So there is a mismatch these days. A lot of people are working on it. We will certainly be working on it, and you undoubtedly will be working on it in your systems if you choose to push forward with conducting research inside your systems. And lastly, it is the case that the data, as wonderful as they are, often don't serve by themselves to answer critical questions. Interventions, randomized interventions, are still the only way to learn with enough certainty to justify implementation whether something works better than an alternative. So this notion of how healthcare systems prepare to conduct randomized interventions within the setting, care delivery settings, is a critical notion. One we believe has got to be part of the learning health system of the future. But how do we talk to our patients and our members about this? How do we talk to our clinicians? How do we get past the clinicians' disinterest oftentimes in this? How do we make this entire enterprise, including the capacity to do randomized studies, an enterprise, a set of activities that has something to offer everyone, the patients, the clinicians, the healthcare delivery systems? Why do we do this? For 2 reasons. First of all, PCORI, although we have made a $110 million investment, we cannot keep making investments of that size going forward. This network has to a substantial degree, sustain itself. And one of the sources of sustenance would be the delivery systems themselves. If these networks prove useful to the systems, then there's much the systems can do to facilitate and support the sustenance and maintenance of the networks. The second rationale for PCORI is that in the legislation that founded us, we're charged with changing practice, with reducing variation in practice, with eliminating disparities, and we need to do that in about 6 years. And that's a tall order, but it has occurred to us that if the research is embedded within systems and serving the needs of clinicians and the delivery systems and the patients, the findings from that research are much more likely to be taken up, put into practice, and we will have a chance of being able to say that we have begun to change practice. So with that, I thank you all very much for traveling. I know many of you came a long distance to get here, and we're excited to see the crowd and the attendance, and I will turn it over to Eric.
Great. Thanks.